And thank you very much for joining our webinar today. But I think today's topic is really good because a lot of people don't realize how or why actually is a complicated subject, but at least a lot of people don't understand why if I have diabetes will have potentially more breast cancer. And statistically, this show there would be potentially chance to get cancer. So that's why I thought maybe perhaps we should get more people to understand and more. So this is something that you need to start pay attention to. And as you know, cancer, if you caught it early, your survival chance is very good. So that's what I'm trying to do. We will start our lecture now. And I think that'll be something that I think today the lecture will put tremendous amount of understanding for you to help you to stay alert. Why we have to, do this check all the time for breast cancer, for example. So, but anyway, what we're going to do today is help you to understand diabetic and breast cancer. What's the link, and understand the link together. And what is the impact of this link? Now that's important because cancer, as I mentioned, you gotta know early, and if not, you're not gonna, because once you get spread all over the place, then you have a big issue. And also, how can you have lifestyle modification to prevention, and how to prevent? What is the prevention strategy, and how should it help you? Now I'll tell you a real story. This is one of our clients who is somewhat serious diabetes because the blood sugar is always 11 and up percent. A1C I'm talking about, and we help her lower her A1C close to 7 and slightly below 7, and she was very happy. Oh, this is good. I'm really able to do real well now. Then I said, hey, I was talking to her because we're talking about, hey, diabetes has few type of cancer you can link up, like for example colorectal and breast. So yeah, why all these link? So I said, have you checked your breast? Now she's an elder lady already. She's 60 years old, and so I think 50 something, not quite 60, but 50 something years old. I said, do you check your breast every month at least to check what it is? And she said, no do that. I said, well, maybe you can check. And so she checked, and then she found this little lump over here. I said, well, if that's the case, you're going to go for a gynecologist potential check. And she did mammogram on that and start finding out she is stage 1, cancer, or breast cancer. So she was, wow, shocked. I didn't know like that. And with that, though, because she is stage 1, that is really good because she can basically remove the cancer. She can be healthy, and she can survive for many, many years. And that is definitely is not So really, at the end of the day, she was so happy because she found she has. And next thing I told her, hey, have you checked your GI, your gut? And she said, no. I said, you got to do that too, because you have that, you got to check other places. So she did follow through. But she was very grateful because we alerted her. If not, she would never know. And that is the sad part. So today I saw a lot of people here who I don't remember the name, and they could be from all over the place. It could be from the United States, from Canada, from different places. So I thought maybe perhaps I still need to go through the 4 stages of diabetes. The first stage is usually the LDL cholesterol goes up, and then it damages your B cells that coming up from the pancreas. The B cells will take the cell take the sugar to the cell to be used. So B cell damage, sugar goes up because it cannot get into the cells, right? So the problem will come because your high LDL cholesterol adding the sugar, the blood becomes very thick and start forming plaques everywhere. And form the plaques will entire body, not only one area of your brain, heart, kidney, everything. And you very quickly move to stage 2 because all these plaques will become less space where blood circulate, and blood pressure will continue to start going up. So second stage, cholesterol go up. Second stage, blood pressure going up. Now, very quickly, if you don't do anything, then you move to stage 3, which is pre-diabetic. And when you have when you get to this stage, what happened? The doctor usually said, "Hey, you already getting to a stage that you if pre-diabetic, and your blood sugar are going from 5.7 to 6.4 during this amount." Now, how they measure that? They actually basically use to measure the amount of sugar attached to hemoglobin. Everybody have hemoglobin. This is the red cell. They measure the percentage of blood sugar attached to hemoglobin. If you're 5.7, you are actually a normal person. You're 5.7 to 6.4, you are a pre-diabetic patient. Now, with that, you have no medication. All the doctor would say you have to change your lifestyle, like exercise, diet, and cut down your weight. But a lot of people don't really understand. And certainly, low sugar tea, that's where it really help you, because they will lower your blood sugar, cholesterol, blood pressure, and detox. And this is the time that low sugar really comes in. If you continue drinking low sugar tea, maybe you will never go to diabetes. So if you don't do anything, sadly, it's 2 to 3 years, you become diabetic. Now, why I introduced a low sugar tea for you to drink? Because low sugar tea has two things only. There's a bitter melon, which blocks the sugar into the gut vessels. And then, bitter melon is increase the insulin sensitivity to get the sugar to the cell. And guava leaf block the sugar going to the gut vessel. So you have two things. Guava leaf block the gut vessel, bitter melon increase insulin sensitivity, take back the sugar to the cells. And then they also dump cholesterol, excess sugar, sodium out through urine. So result, your 3 high will go down plus detox. So it's a really excellent natural product. This is not a drug. This is only a food supplement. And drink tea, and it will help you to help you out. And this is really a wonderful thing to have. Now, besides, really at the end of the day, we don't just want to ask you to drink tea. We want to make sure you have 5 programs, including dieting, teach you how to diet, eating low carb, low fat diet, exercise, and also how lower your weight. You got BMI, if you're 30, we'll help you go down to 23. Weekly webinar, all these are free to help you out, plus how to measure blood sugar. And we do that. And basically with that, you are able to track yourself, understand your condition all the time. Wow, isn't that wonderful? So that way you can be always kind of understand where you're at. And we have helped a lot of people with A1, with the A1C 10 plus above, bring it down to under 6 and approaching 5.7. So this is really good. If you are lower your A1C close to 6 to 5.7, the chances you get all diabetic complication will be very low. Now, so we're going to help you understand what is breast cancer first. And I think this is really an excellent project, webinar, to help you to understand breast cancer is something that if you don't take care of it, if you don't treat, and that is going to be very sad, because you can be could be with a death that will potentially cause your cancer get worse, and you can't treat it, and you can die. Now, first of all, what is the prevailing breast cancer on WHO? Basically, half of all breast cancer usually are women with no specific risk factor, either on age or sex. Okay, so really, majority of the breast cancer all came from women, really. And breast cancer occur in practically every country. You have no excuse. You can be United States, Canada, Hong Kong, everywhere. And the 0.1 to 1% breast cancer could also occur to men. So that's why there is a chance. If there's a lump there, you better check it out. And direct cause of death of breast cancer is 685,000 people on 2020. So it's the 8th global cancer death is a big number. So you got to check. Now, the breast cancer is a disease. Basically, how it goes is you have growth in your breast. It is a tumor, and basically it kind of out of control and will be potential threaten your life if you don't untreat it. So a lot of people can survive breast cancer. They can live for a long, long time to old age. But you don't treat it or you don't care for it, it spread, that will be big trouble. And the earliest stage of breast cancer usually are milk duct, because as you know, you have a lot of duct that produce milk. And it's called lupus, which is the gland that produces milk. Okay. Now this is the area where usually the cancer can invade into this, get this cancer in this milk duct area, and then they will invade to the surrounding tissue on the breast, eventually move to the lymph node and start thickening to everywhere. The worst thing is spread all the nearby area. That will be terrible. And when you have that, it's called metastasis, and that can be fatal. Now, that's why when you have breast cancer stage 1, no problem. You can remove that. You can survive a long time. Stage 2 can too. But when you have stage 2, 3, 4, man, my goodness, you are really not doing good then, because it's spread to all the different places, and you have to have a lot more treatment to be to get you continue to survive. So cancer can be treated and you can survive. So keep that in mind. So it doesn't mean I have an auntie who have cancer. She had both breasts removed. You know what? She's now 87 years old and she's happy as ever. Okay. And she got her cancer sometime in like age 30. And I was very scared for her, but she can survive that long and no issue right now. Okay. So breast cancer certainly is common in women, but certainly is occurring in men, as I mentioned. So you have men just say, "Oh, what lump? Oh, nothing. No, shouldn't have. No, you got to check because that might be also cancer." Now, the risk factor of cancer is basically one, most likely you're age 45 and up. Now, importantly, as a lot of people don't think about it at age 40, but that's the time it occurs, even earlier. So that's why you have to always check your, you have to use a finger, always feel your breast all around to check whether there's a lump. If you have a lump, you got to check it out. Don't ignore it. Or you can be obese, if you're overweight and so forth. Plus, certainly you have some pre-productive history, the menstruation begin, age and so forth, pregnancy, all those has certain factor to be considered, because really, especially during the time of certain menstrual period, certainly you have feel a lot of lump around, but after menstruation, the lump disappear. But that's why you want to check is always not to check necessarily in the menstrual period, but you check it after the menstrual period, because sometimes it's a hormonal issue. It will get you feel like there's some lump, but you have to keep checking. And certainly if you have family history, like your sister, your mom has breast cancer, you have to even more consider that you might potentially have breast cancer. Now, also, if you have radiation exposure, if you're a smoker, and also you have post-menopause, hormone therapy, those things is the actual adding risk for your potential risk of breast cancer. So all these factors you have to consider, and you have to make sure that if you have that, you have to check more often. Now, first, the key to check breast cancer is very simple. It's just breast lump and thickening area. Often there's no pain, and there's really, you don't know that's cancer or not. You have to check with the doctors. So the key here, I suggest once a month, you always have to check from the whole breast, just using the finger and go around, and then check and press and see any lump. If you can feel a little lump, you need to start checking and tell the doctor. Now, there are also other things. There's sign like the change of the size and shape appear on the breast. You'll be a little lump, but it gets bigger. So that for sure it is. Now, also, it can be indented redness, a change in the skin, a certain area. You also have to check, because you go on the mirror, you look at it, you know that is a change. Sometimes that certain area become black, and you got to check. And the nipple also can be a good indication, because sometimes nipple and the skin, the nipple area, actually become red, real red, and start bleeding a bit. And also there might be abnormal blood fluid come out from the nipple. So these are the things that you really have to check, and certainly you have to go to your gynecologist to check and find out, well, is this something that we have to pay attention? Is it potential cancer? So women after age 45 is more so that you really have to check. Remember this age factor? So you got to do that. Now, how the link between diabetic and breast cancer? Okay, now we'll talk about that already. Now, the thing is, if you are diabetic, you have 1.4 to 2 times higher risk to develop breast cancer compared to those without diabetes. So you are about 2 times, 1.4 to 2 times chances more to get breast cancer. Now, especially, you first year identify your diabetes, more so you can right away, you have to check all of it. Matter of fact, if you have no diabetes, you have only high blood sugar, you got to check too. You're pre-diabetic, you got to check because you have higher chance. So best is check every month, or even if you want to check more frequent, you can do that. And so that way you understand you don't have that problem. So if you are type 2 diabetic, even more so you have a higher associated breast cancer. And so you got to check. The key is checking your breast at least once a month, looking for them. And you got to do that. Now, the problem is when your blood sugar goes up, the terminology with that is called hyperglycemia. In other words, you have more blood sugar in the body. Now, the sad part with this is you are promoting breast cancer development, because the sugar is like your fuel, it's gasoline for them. So the cancers say, wow, this is really good, it gives me more food. And also because of that, it causes more inflammation, because higher blood sugar causes more inflammation. And it helps the cancer growth. That's the reason why, more importantly, when you have type 2 diabetic or pre-diabetic, your blood sugar going up, that become a chance of good environment for the cancer to grow. That's why you need to check when you're pre-diabetic and diabetes. The second thing is you have chronic stress. In other words, you are a person that you're executive, you work real hard, and you, wow, keep going. That is stress. And stress causes what? Inflammation. And the inflammation causes the entire body to go to stress. And that's also amplify all the whole body inflammation. With more inflammation, they also give you more chances for your cancer, breast cancer to develop. So importantly is, if you are hyperglycemic, meaning that you are pre-diabetic, diabetes, higher blood sugar, you gotta make sure, check all the time, make sure that, use your finger, this one, use my left, check your left hand, check the right breast, and then right hand, check the left breast, go around, just moving around the entire breast, check it. That's what you're going to do, because that will help you to understand whether you have any growth of a lump. That's what you look for. If you are executive or you just stress, you're a busy mom, you got to do that too, because stress again causes inflammation, and it will cause you to basically breast cancer to grow. Now, another thing too is hormone imbalance. So when you have diabetes and you also with hormonal imbalance, now you have a very complex mix of all the situation, and really now you can have potential also getting this because of continued hormone changes, then give them a good chance for cancer to grow. So hormonal changes, that's why a lot of people with post-menopause, they have a higher chance to get cancer during this time because the hormone go up and down, okay? So those are the things that you also need to check. So your age, 50-something, close to 60, you start getting menopause, more so you have to check. Now, also you have to see other factors. For example, you are a very obese person, you are not physically active, you don't go around do exercise, you don't even walk, you always love to watch TV only, you have a family history with breast cancer, and then you basically have other, besides diabetes, you have other health risks, then these are the factors that add on to getting your potential cancer. So if you have that, do check more often, looking for lump. The key is looking for lump and changes of a breast. So impact to you, what will be the impact? Okay. Now, the thing is, if you are diabetes and you have breast cancer, is really, one, you are very high risk to get breast cancer because you have diabetes. You are high risk to develop breast cancer. And with that, you have several issues that come along. One, your insulin resistance also goes up compared to the one that who doesn't have diabetes. So diabetic actually worsen your prognosis and potential reduce the breast cancer treatment effectively. And that is really important because, with that, if we have diabetes, that one more thing you have to really check is my cancer treatment is more, how can I get maximum cancer treatment? Because it does affect your breast cancer treatment. So make sure you do that. And certainly when you have cancer, diabetes, we have cancer, your breast cancer, and you definitely have to treat. So you might have immunotherapy, you might have surgery, you might have radiation, whatever you have, all that will increase and impact your diabetic. And it might impact your insulin sensitivity, and you might even get higher blood sugar, you have increase of medication, all that will have effect. So when you have diabetic with cancer, one, it will affect your treatment effectively. Two, it also will affect your diabetes because all that treatment come along will definitely affect your insulin sensitivity and so forth. So you got to work quite closely with your doctors to ensure they always know anyway, but you have in mind, I'm a diabetic. So whatever treatment you have on your cancer drug, radiation, also you consider, will have to make sure your diabetic don't get worse. Now, certainly, there are quite a few new devices to help you to get some monitor better your diabetic risk. And this is really important because you have like Abbott Libby, Freestyle Libby, something like this one. Remember this box? This is going to help you to constantly, painlessly, to measure your blood sugar. Now, this is really a good stuff because a lot of time you don't measure while you treat, or you're pre-diabetic. Sometimes people don't treat. So more important, you have to really, at the end of the day, you have to, keep measure blood sugar to understand. And you can see my blood sugar is 6.2 after 1 hour of breakfast. So that's pretty good. So at least I know I don't have anything more than 7, even after me eat. So I continue to measure blood sugar with the Abbott Libby. Now, certainly there is now have several new item is more on the non-invasive blood sugar monitor. As you know, now they use the infrared and radio wave to measure blood sugar without a needle, which now a lot of people have a watch. And I don't know how good that is yet because I did buy one. And when your blood sugar go real high, they don't really measure. If you are low, they can see it. So that is something that my experience. But you might, as time goes on, I know Apple Watch is trying to do that too. So I don't know how that's going to work. But they don't have it. But they are trying. Okay. And breath analyzer and sweat sensor, and that is something also I noticed. There's a new technology coming out. They measure your sweat and your breath analyzer, which will detect your pre-diabetic diabetes, which provide really a good screening tools for you. And certainly there's AI, which glycemic control, and there's create something that with analyzing your continued glucose monitor, and so predict the blood sugar trend and so forth. So AI is coming along big time, but all these are just to give you an idea. There's a new development coming along. But in breast cancer, what's going to happen? Now, basically, you got to have blood tests so you can check really like, is there any tumor cells around? So usually that will also come out, have potential detect your cancer earlier stage, what stage. And certainly, a lot of time people will do mammogram, and really majority of so far many people use mammogram to identify do I have cancer. And at a certain age, a lot of time they also check mammogram. But on the other hand, they also have with that you basically get the mammogram, but make sure follow through and make sure you do that. And so there's a thing called breast density assessment. Again, this imaging, like ultrasound, MRI, so also review potential you have tumor on the breast. And certainly you have PET test. Now, PET test is really important. If you truly have a lump here, they want to do a PET test to scan. This lump is just located in one area, or it go to many places, which is called metastasis. So when you have a lump, usually you gotta really, they always now, a lot of doctors will, I want a PET test to make sure you have no spread. Now, if you have cancer, just stage 1, which is not spread, a lot of doctors will say, okay, we'll surgical remove the cancer, and then we'll have to look for, is there any other treatment like radiation or removal all the around surrounding area, all the cancer cell will be died. So they really want to check that. So now the AI assessment, imagery. So really a lot of new technology coming out. So you are, if you are early stage of breast cancer, your chances to survive very good. And make sure that you take action. The key is take action. Don't delay. Take the action so you can able to, for sure, you can do that. Now, certainly with that, you can also, before you even get to this cancer, or you already cancer, you still need to have this lifestyle change. There's a reason why you got to do lifestyle change, because with that, you lower your blood sugar. You don't give the environment to allow your cancer to grow in a good environment. You don't want to do that, right? So you really need to have a balanced diet, like vegetable, whole grain, lean protein, meaning you eat, all the white meat chicken or chicken skin, a lot of fish, but not red meat. A lot of fish, meaning you got to eat fish like halibut or salmon. And then certainly you got to drink low sugar tea, because low sugar tea help you lower blood sugar, cholesterol, and your blood pressure, and detox. So you got to drink every day 2 glasses before and after meal, and then you have 6 to 8 glasses a day. Now you have to do exercise, 150-minute intense exercise per week. And certainly you can get a barbell, you go up and down like this, okay? And then you do it at least 20 times. That will be really good. So you got to enhance that with the exercise. And if you, after dinner, walk at least 45 minutes to an hour, wow, that will be really good for you. And you can quit smoking, because smoking is not going to help you. Smoking can also increase the developed diabetes, and you can also cause breast cancer. So definitely don't smoke. Now that's, if you smoker, it's not only breast cancer, you can also have lung cancer. So that double whammer, you don't want to do that. So you also need to maintain your weight, which means you have to lower your weight. If you're 30, if you are overweight, your BMI over 30, you can lower down to 23, and that's really good. Then you can significantly reduce your diabetic risk. If you lower 1%, 10% of your weight, you lower 1 percentage point of your A1C. Isn't that great? So you got to continue to do that. The last but not least, manage your risk, the stress. Manage your rest is very important because when you stress, your hormone cortisol go up, adrenaline goes up. All these is get you more sugar plus increase your inflammation. Remember, inflammation is enhance the cancer growth. So you gotta have good rest. Don't stress yourself much. Sleep well, good sleep, and you can able to relax, regenerate yourself. All that will be very important for your good health, not to get cancer. Or even you have cancer, you are going to be treated. This still got to be doing that. That will help you to fast recovery. Now, the proactive measure is you got to continue for diabetes, you continue to measure your blood sugar, A1C. Very importantly, you have to prevent A1C complication. So measure yourself. If you are diabetic, get one of these things to measure yourself, to understand what kind of sugar are you in. And this is Abbott Libby, and it's good. So you can tell I'm 612 today. And after eat, you can always show are you high or low. And after you drink low sugar tea, you can really see your blood sugar going down. Now, secondly, you have to have monthly check your breast. Make sure that check your breast, left, right, both with hand. Feel for lump. Now, if you really found out you have cancer, you have a lump, go to see doctor. If a cancer, say, oh, wow, this is truly a cancer, or we don't know, you got to check. But the examination is definitely with a mammogram, MRI, and then eventually they say, okay, that is potential cancer. They might get a tissue sample, like a biopsy. And then they will also look at what stage are you? Is there any lymph node involvement? And can it be treated by like surgery first? And then eventually check, is there any spread around? There may be radiation, or it could be potential, could be chemotherapy, all that. The key, treat, and get all the cancer out of the way. So that is the key things you got to do. And don't wait, because a lot of people say, well, I'm not sure I'm cancer. I don't know. If you wait, this thing will continue to grow, and that can be a life-threatening to you, and you don't want to do that, because getting worse is spread because your delay time process. That is not good. So take action and immediately get to the doctor, check mammogram, see whether it is cancer or not. Okay, and so certainly low sugar will help you on pre-diabetic diabetes, lower blood sugar, cholesterol, blood pressure, and detox, and definitely help you. So we take care of blood pressure, blood sugar, and bad cholesterol. If you lower your three high, the chances for you to get sort of pre-diabetic will not be, the risk is not be there. And then complication is also not be there. So really, at the end of the day, if you can lower your blood sugar, those eliminate all the key risks. A lot of people don't realize, even you're pre-diabetic, you can be, your blood sugar continue low, but you can be potential because previously you have some problem. You can be continue to move upward. You don't know. So you have to continue to measure blood sugar. You check your eyes every year, because as time goes, things might change. You might need to be treated. So got to get your eye examination. So in conclusion, we know now in relation to diabetes and breast cancer, certainly it's a complex issue, but it's highly linked, because the blood sugar goes up, create inflammation, giving the breast cancer a good medium to grow. Now, then with that, you understand the connection now. Now you have empowered you with this knowledge. You need to go around to actually check every month, check your breast, see any lump. The first thing, check lump. Okay, now if you are able to detect that lump, then you have to take immediate action to go see a gynecologist to check whether this lump is meaning something. Now, naturally, they might go to mammogram and so forth and so forth. They may take biopsy if you see that lump is there, and then you have to proactive to look for all the diagnostic to help you to move yourself going forward to make sure it is treated. The key is action to be treated. So it might take surgery if it is cancer, and after that they would see if you have spread anything, and you might take radiation therapy, could be target therapy, all that will come along. But that will be all in your doctor recommendation to do through your healthcare provider. Importantly, really, you have to understand this. The first thing is screen, to make sure, screen with the hand going around, look for lump. After that, if lump actually occur, you have to go for mammogram. Understand this mammogram as cancer or not, you talk to the doctor. If it is, then you have to follow the treatment. So the healthcare provider will basically follow through with you. The important thing is you understand this is the serious thing that you have to do, and you have to take action. And that's what today's message. Don't wait. Cancer, do not wait. You have to be treated. So anyway, I'm happy to complete my webinar today. If you have any question, write to me, Andy, A-N-D-Y, at wafong.com, A-N-D-Y at WAHFONG.com, A-N-D-Y at WAHFONG.com. Or you can WhatsApp me. WhatsApp number 852-6792-8891. WhatsApp number is 852-6792-8891. You have a question, do ask me, and I will try to answer you. So I hope you enjoyed this webinar. I hope you can able to better understand the risk for diabetes to create cancer is real. Breast cancer is real. So you need to associate with that. Then you have to check for lump. The important check for lump. Monthly check. If you have lump, go see doctor to see whether this is identified as a cancer or just a normal lump. So that is important. Okay. So good. Thank you very much. If you have no questions so far, I appreciate your help, and we'll talk to you next week. Okay. Thank you very much again. Take care. Bye-bye.